Okay, welcome everyone. Thank you for joining the active employee and non-Medicare retiree general medical plan overview. We have our representatives today from Blue Shield, HealthNet, Canopy Care, Kaiser Permanente, and our very own HSS Member Services, who will be happy to answer your questions through the Q&A comments box. Your microphones will be muted during the entire webinar, but we encourage you to ask questions through the Q&A box in your menu bar. The presentation has been pre-recorded to allow our representatives to focus on answering your questions. At the end of the presentation, you'll be able to hear our representatives answer your questions from the Q&A box, and you'll be able to hear them as well. And with that, let's get started.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for Plan Year 2026. Open enrollment is a period each year when all members can enroll in benefits coverage and change their current benefits coverage for the upcoming calendar year. You can change from one plan to another, enroll or waive coverage, add remove dependents from coverage, enroll in flexible spending accounts. If you do nothing, your current year benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts each year to participate. Your new benefit choices are effective January 1st, 2026. Open enrollment starts at 8 a.m. on Wednesday, October 1st, 2025, and ends at 5 p.m. on Friday, October 25th, 2025. You may enroll online through SF My Hub, located at sfhss.org. How to enroll. Find the open enrollment tile to access the My Health benefits to make your new benefit elections. City and county employees can also access SF My Hub through the SF My portal. Paper applications must be postmarked by October 24th, 2025 to be accepted. You'll be on mute and off camera for the entire presentation. We encourage you to ask questions. We will be using the Q&A function in Microsoft Teams. Scroll through your screen to find the menu bar, either at the top or bottom of the screen, depending on whether you're using your computer or mobile device. Click on the Q&A icon in your menu bar. Click on Create Post to type your question. We will answer as many questions as time allows during the Q&A session. Please do not share personal medical information in the chat. Everyone can see it. We recommend a one-on-one consultation. If you have questions that do include personal and private medical information, please schedule a private one-on-one consultation with a health plan vendor. Our health plan vendors have open enrollment office hours. To schedule an appointment, visit sfhss.org/OE2026. If you have eligibility questions, please call SFHSS Member Services at 628-652-4700 or visit our offices at 1145 Market Street, the third floor, during our business hours listed on the screen for further assistance. And we want to remind everyone to get their annual flu shot and COVID booster to protect yourself and your loved ones this fall and winter. With that, our presentation will now begin.
Good afternoon, everyone. Thank you for joining us today for this webinar to kick off your 2026 open enrollment. This is now the 5th year of our HealthNet Canopy Care HMO plan being offered, and we're excited that you've joined us for this webinar to learn more about the plan and all the wonderful programs that come with it. But first, quick introduction on the speakers. My name is Fred Reyes, and I'm representing HealthNet. And with me today, I have Emma Welch, who is representing the medical network. And combined, we're able to offer city and county of San Francisco employees, as you can see here, our powerhouse Canopy Care HMO medical plan. Next slide, please. So I'm going to hand the presentation over to Emma now to walk you through the partnership that was created between HealthNet and Canopy Care. So Emma, I will hand it off to you.
Thanks, Fred. So the HealthNet Canopy Care HMO offers you and your family an affordable way to access the Canopy Health Network. And the Canopy Health Network includes some of the best hospitals and medical groups here in the Bay Area. And as a UCSF Health affiliate, Canopy Health does offer access to the UCSF physicians and hospitals. So in addition to UCSF, we do have 5 medical groups you'll see listed. So John Muir Health, Health Physicians, SCIPA, Dignity Health, and Providence. 30 hospitals, and over 100 urgent care centers. And then as you can see on the map, we are in all 10 Bay Area counties. So we're in Sonoma, Napa, Marin, Contra Costa, Alameda, San Mateo, and Santa Cruz, and then partially in Solano and Santa Clara counties. Network features. So we do offer over 5,000 providers, 30 Bay Area hospitals, as mentioned. We have a world-class academic medical center with UCSF Health. We offer an Alliance referral program, which I'll explain a bit more in the next slide, and then 24/7 virtual urgent care with the doctor. The Alliance referral program is unique to Canopy Health. It gives you the choice to access specialists outside of where your primary medical group is. So in most HMOs, you can only get your care within your medical group, but Canopy Health gives you access to all our specialists to find one that is right for you. Even those outside of your medical group. So there is a bit of a process with it. So first you'll meet with your primary care doctor to explore options. And then if you both decide that a specialist is needed, you and your doctor will discuss what the best option is within the network. From there, your doctor will send a referral request to your medical group's referral department. And then once that referral is approved, you and your specialist will be notified. And then from there, once it's approved, you are free to schedule an appointment. And then if you do have any questions specifically about the Alliance Referral Program, we do have a dedicated email, and that you'll see listed on the slide as challiancereferrals@canopyhealth.com. For what's new this year, so lower rates is one of the most affordable options. Canopy Care continues to offer you and your family access to the same high quality hospitals and medical groups. For network news, I think we shared this last year, but just wanted to share again that the UCSF and John Muir Cancer Center in Walnut Creek opened last year in February. And then the UCSF Bayfront location opened about a year ago. There is an urgent care at this location. It's open 7 days a week from 8 a.m. to 8 p.m. and walk-in appointments are available. And then Teladoc Health, telehealth services. You can talk to a healthcare provider through a virtual visit when you're not able to see your primary care doctor, and they can help with everyday non-emergency conditions. So, like the flu, stomach bugs, sinus infections, and more. And then I'll hand it back over to you, Fred.
Thank you, Emma. So before we move on, you're going to hear me mention our dedicated website throughout this presentation, and that is healthnet.com/SFHSS. And if you're exploring options, you can visit this site to learn more about HealthNet and what we offer. And if you're an existing member, remember you have access to many online tools. Next slide, please. So next, we're going to talk about our behavioral health solution we offer our city and county employees. Next slide. So I won't go everything that's over this slide here, but when it comes to access to care, we have you covered. We have over 22,000 in-network behavioral health providers, with over 5,000 of these providers accepting both in-person and virtual care. We have a 24/7 call center, integrated care management program. And so what that basically means, if you ever need any higher level of care, your primary care physician and your therapist work together to make sure you get the proper care. Next slide. So this is a quick benefits at a glance of your behavioral health benefits. Important to note that no referral or authorization is needed for any outpatient office visits. Co-payments for outpatient care is a $25 co-payment. Higher level of care, that would be inpatient admissions, that would be $200 per admit. And then outpatient services, that is covered at 100% under the plan. Next slide, please. All right, so next we're going to go over our alternative medicine benefits, which include acupuncture, chiropractic, and massage therapy. Next slide. So our acupuncture and chiropractic network is through American Specialty Health. They also go by ASH, ASH. No referral is needed from your primary care physician to access this network. You can self-refer directly to any ASH provider, and you're only responsible for fixed co-payments, which will go on the next slide. And so here you can see again, no referrals or authorizations needed. For routine chiropractic care, it's a $15 copayment for up to 30 visits per calendar year. For routine chiropractic care, $15 per visit. Again, a separate 30 visits per calendar year. And then for massage therapy, we offer a 25% discount on fees from network massage therapists. Next slide. Now, in the next couple of slides, we'll cover our wellness programs as well as our value-added programs, most of which are free and zero cost to our members. Next slide. So first up, we have our Real Age test. This is a personal risk assessment where you can earn a $50 gift card just for taking the test. It takes no more than 10 minutes and up to $50 more for completing other healthcare activities such as sharing the results with your primary care physician. We already talked about telehealth or teledoc virtual health and WellVie, which is our decision support program that helps our members decide on, prepare for, and recover from surgery. Members can also earn a $25 e-gift card just for completing a couple of the program modules. Again, just to simply learn about what WellVie is. Next slide. Now, we do have some behavioral health wellness programs as well, and we provide a great self-help program for our members through Teladoc Mental Health, that digital app, which provides support for stress, depression, sleep, and more. And then Unwinding, which uses mindfulness to help our members build resilience. So members are able to use it throughout the day whenever they find themselves feeling stressed or if they need to get a quick dose of calmness. Through the use of breathing exercises, meditation, sleep support, and visual relaxation, members can start experiencing less stress in their life. Next slide. And the last two programs we want to cover from this section is our gym fitness membership discount program through Active and Fit, and as well as our healthy discount program that allows members to purchase items at a discounted rate, such as vitamins, hearing aids, eyewear, the massage therapy discounts that we previously mentioned, as well as weight loss memberships. Next slide. Now, in the next couple of slides, we'll cover what you can expect when changing plans. So first, we'll cover the medical basics. So reminder, HealthNet does auto-assign you a provider for the upon enrollment. However, you have 90 days to make that correction. So if you actually have a primary care physician that you're currently seeing, that's within the network. We can definitely make that correction back to the 1st of January. Now, if you are someone who's seeking care with the provider currently, that's not part of the HealthNet Canopy Care Network. We offer our members continuity of care. So that's in a situation where a provider, again, is no longer in our network, or a member has a qualified condition, or there's a pre-existing provider relationship. There's a form that gets filled out, and there could be the possibility to continue care with that non-contracted provider for an extended period of time. And for non-urgent care appointments, we do, these are hard to come by between the months of January and March. So it's always a good idea to make sure you schedule an appointment early on, confirm availability of your doctor as soon as you can, or when you get those HealthNet ID cards around the beginning of January 1st. Next slide. Now, in terms of the pharmacy program basics, again, we strongly encourage members to identify the new drug list, the differences in prior authorization requirements, and the cost share differences. And to assist with this, we've designed a benefit member guide on our website, again, healthnet.com/SFHSS, to help members easily understand the drug list and, again, where their drug may fall under in terms of prior authorization or quantity limit requirements. Now, it's very important to understand that prescriptions, authorizations, and clinical criteria notes, those don't get transferred to a new health plan. But in order to avoid any issues with your current prescription or any self-injectables, members are able to complete HealthNet's prescription transition form, which is available again under our website. And that would allow the information of that previous prescription with the previous health plan to carry over to HealthNet. Next slide. And now we want to cover some access to care alternatives very quickly. So in the next slide, you'll see here, again, Teladoc, which we already covered. This is a great program to access, especially for those members who may have college students or if they're traveling. Teladoc is available 24 hours, 7 days a week, and available anywhere in the US, again, while traveling. And we also have a nurse device line for our members. and that aims to reduce avoidable ER visits. Now, one thing I do want to mention is since our Canopy plan is an HMO model, all routine care does need to be provided back in that Bay Area service area. Next slide. And one final important thing to let you know about is our open enrollment office hours. This is your opportunity to schedule an appointment and talk with one of our customer service agents about any questions or concerns you may have about our plan, or if you're considering making a switch to HealthNet Canopy Care. The calendar link to the to schedule an appointment is available again on the top banner of our dedicated website. You just click the time and date that's most convenient for you. Next slide. And so as we close, we want to summarize why someone would want to consider choosing Canopy. And again, we provide affordable access to some of the best hospitals and medical groups in the Bay Area, easier access to specialists through the Canopy Health Alliance referral program that we covered at the beginning of the presentation. Canopy is a network of choice for many doctors, nurses, and families around the Bay Area. And last but not least, HealthNet's whole health member-centric programs and services that we covered, which are intended to support our members' physical, behavioral, and emotional well-being. So this concludes our presentation. We just want to thank you again for your time today. We hope you found this presentation helpful. And again, we wish you good health in 2026. Thank you.
Good afternoon, and thank you for joining today. In this presentation, we will be going over, at a high level, the Access Plus, Trio, and PPO plans available to San Francisco Health Service System members, effective January 1, 2026. Let's begin by taking a quick look at the Access Plus and Trio plans. SFHSS members have the option of two HMO plans, Access Plus or Trio. The Access Plus and Trio plan benefits remain the same from 2025 to 2026. Both HMO plans require you to choose a primary care physician or PCP. These PCPs are associated with an Independent Physician Association or IPA, often referred to as a medical group. Members must stay within their chosen IPA for all services. Both the Access Plus and Trio plans have fixed copays for most covered services. The benefits for both Access Plus and Trio are the same, with the network being the only difference between the two plans. The Trio network is a subset of the Access Plus network and is only available in select regions of California, whereas the Access Plus network is Blue Shield's full HMO network and is available throughout the state. Access Plus and Trio members have access to virtual medical and mental health care via Teladoc at a $0 copay. Access Plus and Trio members also have access to an extensive pharmacy network, including all the major chains such as CVS Pharmacy, Walgreens, and store locations such as Walmart and Costco. Members also have access to Amazon Pharmacy's home delivery of prescription medications for 30, 60, and 90-day supplies. Access Plus and Trio members can get answers to their questions about plan benefits, ID cards, provider network, claims, medications, language assistance, condition management, and more by connecting directly to their certified team of healthcare experts via Shield Concierge. The Access Plus and Trio plans include coverage for emergency and urgent care services only when traveling. The Blue Card program expands your service area, giving you access to hospitals and urgent care providers almost everywhere. Also available to members' dependents who attend school outside of California is the Away from Home Care program. The program provides convenient healthcare coverage while temporarily residing in another state. To learn about your specific out-of-area healthcare coverage, members should call a Blue Shield Away from Home Care specialist at 800-622-9402. Taking a high-level look at the benefits for both Access Plus and Trio plans, you'll see the benefits are the same. As previously advised, the benefits are the same for both plans, with the network being the only difference between the two. Both plans have no deductible with an out-of-pocket maximum of $2,000 individual and $4,000 family. Both have a $25 copay for PCP visits, $30 copay for specialist visits with lab work, and Teladoc at a $0 copay. Outpatient surgery in hospital is $100 per surgery, and inpatient hospitalization is $200 per admission. Both have chiropractic and acupuncture benefits at $15 per visit, up to 30 visits per member per plan year each. There is no pharmacy deductible for either plan, with retail drug copayments of $10 generic, $25 formulary brand, and $50 non-formulary brand. Home delivery is available for 2 times the retail copay. Programs available to Access Plus and Trio members include the following: Shield support, nurse support, home visits, self-management tools, and workshops to help members with a variety of conditions. Nurse help 24/7, immediate answers to health questions from registered nurses available 24 hours a day. Maternity program, offered through Maven, provides virtual care support if you're pregnant and up to 3 months postpartum. Life referrals 24/7, available for simple questions like quick ways to de-stress or how to find more time in your schedule, to more difficult issues like finding support after the loss of a loved one. There are a couple of programs offered exclusively to Trio members only. Non-emergency transportation for eligible Trio members recovering from a serious illness. This program offers reliable transportation to and from medical appointments. Free meal delivery for eligible Trio members is a convenient and nutritious meal delivery service for members recovering from a serious illness. The program offers prepared meals geared towards special dietary requirements. Eligibility for both programs is determined by a Blue Shield case manager. To learn more or to see if you qualify for both or either program, members should call Shield Concierge at 855-747-5800. Now, let's look at the PPO plan. SFHSS members have the option of selecting the Blue Shield of California PPO plan. The PPO plan benefits remain the same from 2025 to 2026. The PPO plan utilizes the Blue Shield of California PPO network. Members have the option of using an out-of-network provider for a higher cost share. This allows members the option to see any doctor of their choosing, both in or out of Blue Shield's network. The PPO plan is also available nationwide. If accessing doctors or facilities in other states, members would utilize the local Blue Cross Blue Shield plan of the state they're in when searching for a doctor or hospital. PPO members have access to Blue Shield Connect, which includes access to customer service representatives and a dedicated care manager who are available to assist members with questions they have, from helping find a doctor, finding treatment options, assisting with authorizations, setting health goals, and coordination of care. Here is a high-level look at the PPO plan. The Blue Shield of California PPO plan is a coinsurance-based plan with a deductible that must be met before Blue Shield, as the plan pays anything. The deductible for an individual is $250 and $750 for a family and network, or $500 individual and $1,500 for a family out of network. PCP, specialist, lab work, Teladoc, outpatient surgery in a hospital, and inpatient hospitalization are all 15% in network after deductible, or 50% out of network after deductible. Chiropractic and acupuncture are both 50% up to $1,000 maximum per member per calendar year after deductible. There is no pharmacy deductible, with retail drug copayments of $10 generic, $25 formulary brand, and $50 non-formulary brand. Home delivery is available for 2 times the retail copay, in network only. Programs available to PPO members include the following: Maternity program, offered through Maven, provides virtual care support if you're pregnant and up to 3 months postpartum. Life referrals 24/7, available for simple questions like quick ways to de-stress or how to find more time in your schedule, to more difficult issues like finding support after the loss of a loved one. Now, let's look at mental health resources offered to HMO and PPO members. Let's start by talking about a change to behavioral health administration that will impact Access Plus and TRIO members. Magellan will continue to provide mental health services until December 31st, 2025. Beginning on January 1st, 2026, Blue Shield will provide these services to Access Plus and TRIO members. The vast majority of behavioral health providers are already part of Blue Shield's network. Beginning in October, members seeing providers who are not in Blue Shield's network will be receiving information on how to make a request for continuity of care. If you have received an authorization for behavioral health or substance abuse treatment that carries over into 2026, it will be honored. SFHSS PPO members will continue to access the Blue Shield of California network for all their mental health services. SFHSS members have access to 3 virtual care programs. Teledoc, where members can make virtual appointments with behavioral health providers between 7 a.m. and 9 p.m. Pacific Standard Time. Members will need to have a Teledoc account before attempting to schedule an appointment. To register, members should go to blueshieldca.com/Teledoc, click the login link, which will take them to the member login and registration page. To register, members would click on the Get Started button and follow the directions. If you already have an account, members will simply log in and then proceed to schedule their appointment. Next, Nurse Help 24/7 can be used for referrals to providers or county mental health resources. Only available to Access Plus and TRIO members. Finally, Life Referrals 24/7 connects members to licensed therapists, 3 sessions in any 6-month period. SFHSS members also have access to Headspace and Headspace Care. Members can visit wellvolution.com/mental health for additional information. Credible Mind empowers everyone's mental well-being. Anyone can access Credible Mind without logging into the Blue Shield portal to view resources, articles, and questionnaires. However, by creating an account with Credible Mind, members can save questionnaire results and opt in for ongoing engagement, including content and topical newsletters. Next, let's talk about pharmacy benefits and the SFHSS microsite. SFHSS members have access to a redesigned pharmacy hub within the member portal that makes it easier for members to view and manage their prescriptions. With the new Price Check My RX tool, members can find the lowest cost option pharmacies and home delivery options when available. Members opting in to push notifications receive mobile alerts for prescribed drugs during a doctor visit and when a lower cost option is available. Members will continue to enjoy a robust retail pharmacy network, which includes national chains such as CVS Pharmacy and Walgreens, plus independent pharmacies and discount grocery store locations such as Walmart and Costco. Amazon Pharmacy Home Delivery is available for prescription medications for 30, 60, and 90-day supplies, or more if available. SFHSS members can also continue to utilize CVS Specialty for 30-day supply for specialty medications. SFHSS members have 24/7 access to all their plan information with their dedicated Blue Shield SFHSS microsite. Members can find overviews of their plans, plan documents, links to find a doctor, and details on programs and services. To access the microsite, SFHSS members can go to blueshieldca.com/SFHSS. Simplify your life and go digital. By registering online, you have access to features like your digital ID card, benefits, claims, plan status, finding a doctor, and more. Go to blueshieldca.com/register to complete your registration. If you're an Access Plus or TRIO HMO member, be sure to register with your medical group as well. Registering allows for easy access to your medical group's online portal and the many features it will open to you. SFHSS members can find doctors, specialists, hospitals, and pharmacies for both the HMO and PPO plans by accessing the following. For Access Plus, members would go to blueshieldca.com/network HMO. For TRIO, members would go to blueshieldca.com/trio SFHSS. To find providers in California, PPO members would go to blueshieldca.com/network PPO. To find providers outside of California, PPO members would go to provider.bcbs.com. Now let's take a few minutes to explore Wellvolution. Wellvolution is a digital platform that guides members 18 and older on their health journey. Wellvolution customizes members' path to better health, matching them with clinically proven programs and apps that are right for both their mind and body. Through Wellvolution, members have access to lifestyle-based tools and support designed to help them lose weight, treat diabetes, nurture mental health, and more. Members get personalized plans, on-demand tools, and health coaches to assist them in reaching their goals, all at no extra cost. Members can get started by going wellvolution.com. Wellvolution offers 6 paths for members' health journeys. Weight management and diabetes prevention, offering personalized support to lose weight, improve overall health, and feel better with programs offered by Weight Watchers, Better, Personify Health, and more. Diabetes management with Dario, offering vetted methods to help control type 2 diabetes and limit your risk of chronic disease. Also with Dario, blood pressure management, offering at-home blood pressure management program for a healthier heart. Stress and sleep management, supporting your well-being with app-based therapy sessions, behavioral health coaching, meditation, and mindfulness programs with Headspace and Headspace Care. Tobacco cessation, helping members break the habit with tested strategies that help you beat nicotine cravings and addiction with EX program and Life. Fitness and physical therapy, to relieve joint and muscle pain and increase strength and flexibility with app-based physical therapy, ergonomic support, and a PT finder with Swore Kit Health and Kaya Sword. I want to thank you for joining today to review your SFHSS Blue Shield benefits and programs offered for the 2026 plan year. Thank you again, and have a great day.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan which makes your life easier. Today, I'll be highlighting our integrated quality care, digital care options, and membership perks. This shared information will help you select with confidence the right health plan for you and your family. Before we start, please tell us what you think. We invite you to complete a 2-question survey at the end of the presentation, which will take less than a minute to complete. Now, are you ready to get started? Great, let's begin. Kaiser Permanente provides high-quality care designed for your total health. That includes care for routine checkups, complex treatments, and mental wellness, and care for building strength, reducing stress, raising a family, and new goals. No matter what your priority is, ours is providing excellent care when and where you need it. Your doctors, hospitals, and health plan benefits work together to give you exceptional care when and where you need it. Everything is connected, so when you get care in person or virtually, your doctors have access to your entire health history and can pick up where you left off. You have 24/7 access to care wherever you are, from virtual care, video, and phone visits to in-person appointments. You can choose how, when, and where to get care, plus stay on top of your care 24/7 with the Kaiser Permanente app or at kp.org. If you prefer to visit in person, same day, next day, and weekend appointments are available at most locations, and many facilities have labs and pharmacies in the same building. We support your mental health and wellness because your mental health and lifestyle are essential to your total health. Kaiser Permanente includes many resources for self-care at no extra cost. Take advantage of popular self-care apps to help reduce stress, improve sleep, and manage overall mental wellness. Get high-quality preventive, primary, and specialty care with most plans, and a wide range of preventive care at no extra cost. If you need specialty care for maternity, cancer, heart health, or anything else, you have access to cutting-edge technology and the latest evidence-based care, and you can change your doctor at any time, so you always have a health partner you know and trust. We're all used to getting instant information on our phones. When it comes to healthcare, there's a lot of noise to sift through. If you have a health question, a quick Google search might get you hundreds of articles, influencers, and AI summaries with different recommendations. But with Kaiser Permanente, you can get high-quality healthcare as easily as ordering a ride. Simply go online or sign into the Kaiser Permanente app to connect with your care team. Make an in-person or virtual care appointment, order prescriptions, or manage your care. When you need care, you can talk to a clinician in person, by email, over the phone, or by video. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. With our national network of locations, doctors, and specialists, you can get timely primary care appointments and quick lab results. Same day, next day, and weekend appointments are available at most locations, and because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. It's easy to refill prescriptions online on the Kaiser Permanente app, in person, over the phone, or by mail order. You can have most delivered to your home with same-day or next-day delivery, or order your prescriptions for same-day pickup. Get refill reminders or alerts when new prescriptions are available to order via text, mobile app, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. With Kaiser Permanente, you're covered for urgent and emergency care anywhere in the world. If you're planning to travel, we'll help you get vaccinated, refill prescriptions, and stay on top of your health while you're away. If you need to refill a prescription while traveling, you can get your medication refilled at a local pharmacy. If you need emergency care, always use the emergency services where you are, and contact Kaiser Permanente when your condition is under control to make your care team aware of your condition and discuss your treatment. Now let's go into more details about the Kaiser Permanente plan options available to you, including high-level coverage amounts. You can choose from the following medical plan options. Let's take a closer look at the high-level coverage amounts of your plan options. For specific information about your covered health plan benefits, limitations, and exclusions, please review your evidence of coverage or speak to your benefits administrator. If you need additional time to review this information, press the pause button in the lower left-hand corner of the screen at any time. Here is an overview of the plan option being offered to you. Chiropractic and acupuncture care services are also included. These services are covered when provided by an American Specialty Health Plan participating provider. You can obtain chiropractic and acupuncture services without a referral from a plan physician. Call or visit the website on the screen to find a participating provider near you. The One Pass Select Affinity program provides in-person and digital fitness memberships that range in pricing starting at $10 per month. In addition to fitness, members who sign up with One Pass will have access to healthy meal deliveries with Walmart Plus. And enrolled members will have access to the Affinity Musculoskeletal program, which provides discounts on chiropractic, acupuncture, and massage therapy. For more information, visit onepassselect.com. Employees can choose the plan that fits their needs. This slide illustrates the different membership levels and the costs associated with each. Good health goes beyond the doctor's office. With Kaiser Permanente, you get a wide range of personalized support for your mind and body, designed to fit seamlessly into your lifestyle. For your mental and emotional health, Kaiser Permanente provides clinical and support services for a wide range of conditions, including anxiety, stress, depression, addiction, and autism spectrum disorders. Our mental health team includes psychiatrists and psychologists, as well as marriage and family therapists, addiction medicine physicians, and medical social workers. And you don't need a referral for mental health care within Kaiser Permanente. Practice self-care with popular apps to reduce stress, improve sleep, and manage overall mental wellness. For your physical fitness and lifestyle, here are some of the wellness resources to help you stay healthy once you register at kp.org. Health classes. Choose from a large variety of classes and support groups offered in person and online. Some classes may require a fee. Online wellness tools. Join a program to help you lose weight, reduce stress, quit smoking, and more, at no additional cost to members. Find helpful videos and articles, health calculators, podcasts, recipes, and more. Finally, wellness coaching by phone. Get one-on-one guidance and support from a dedicated wellness coach who can help you set goals, stick to them, and most importantly, see results. And you can do it all from the comfort of home. Partnering with a wellness coach can help you manage your weight, reduce stress, quit tobacco, eat healthier, and increase activity. You can sign up through your benefits administrator over the phone with a Kaiser Permanente enrollment specialist, or by entering some basic personal information at kp.org/choosekp. After you sign up, we'll reach out to help make your enrollment as easy as possible. We can help you transition your care, easily move prescriptions so your treatment is uninterrupted, and find a care location that's close to your home, work, or school. You can choose your new doctor, browse doctors by location, and see details about their education, specialties, languages spoken, and more online. Choose your doctor based on what's important to you and change it anytime. Within 10 days of your start date, you'll get a personalized welcome book in the mail, a welcome call from us, and your ID cards. And once you make your first appointment, you'll get a pre-visit call. Thank you for your time and attention. Today we reviewed our integrated quality care, digital care options, and membership perks. Please visit kp.org to learn more. Now you have the information you need to select with confidence Kaiser Permanente as your health plan.
All right, we will now begin our Q&A session. I've turned on my camera, but for some reason it's not showing my face on there. I'd like to ask our vendors to turn on their cameras and answer the questions our members have been sending in the Q&A box. I want to remind you, our members, that you can still send us your questions by typing in them in the Q&A box. Look for the Q&A box in the menu on top of or the bottom of your screen. And please do not share any personal medical information, as everyone will be able to see it. We will be ending this webinar promptly at 1 o'clock to allow our representatives to support other members. We'll have a last call for questions 5 minutes before it ends. So now I'm going to go back to the questions so they can be recorded in our videos. And just to mention, once we are done with this webinar, this recording of this webinar will be housed in the same place you found us on the calendar at the open enrollment website. Okay, so let me go back to the beginning of these questions. The first one was, if I don't re-enroll in FSA, can I still roll over this year's funds into the next year? And the answer is pretty straightforward. For plan year 2025, you can roll only a maximum of $610 into plan year 2026. The next question is, what happens with my health plan coverage if I retire from CCSF next May in 2026? And again, this is another straightforward. I'll just read it off, but maybe Olga or Liz can chime in if they want to. It says, if you wish to enroll in retiree health coverage upon retirement, you will be required to actively enroll in retiree health coverage. We have a website, which is listed on here, and it has the steps to follow as well. You can find it at our website, sfhss.org/planning-2-retire. Was that it for that, Liz or Olga? I think that's pretty straightforward, right? Okay, hearing none, so, okay, thanks. The next question is, under Blue Shield, do I have a discount membership for YMCA? And Adam says, from Blue Shield does offer Fitness Your Way powered by Tivity Health. To see if your local YMCA is covered, you need to reach out to Tivity Health. And again, the website is listed on here, fitnessyourway.Tivity Health, that's TIVITY health.com / I don't know, Ed, if you want to add on to that, or that's pretty much.
Nope, that's pretty much it.
Okay, good. Let's see. And again, if I miss anything on here, please feel free to type in your questions. Next question is, when I try to find clinics or hospitals on HealthNet, not many appear on the map. My daughter goes to school in CS UMB. I cannot see any hospitals or clinics in Santa Cruz. How can we see a list of all the facilities offered? And there are a few answers here from Emma with Canopy Health. Canopy Health partners with Dignity Health Medical Network and their affiliated hospital. The Vatican Hospital is in Santa Cruz County. And our member asked another question, are there any locations in Watsonville? And Emma says, yes, Watsonville Community Hospital. And I hope that answered that question. Again, if that's not clear enough, you can retype your question on here. I don't know, Emma, if you'd like to add something on or.
You can visit
Sure.
canopyhealth.com to see all of our providers in every county, and you can filter by zip code.
Great, thank you. Another question here, is prescription drug coverage identical between Access Plus and Trio? And according to Adam with Blue Shield, yes, all medical and pharmacy benefits are the same between Access Plus and Trio. Only the network is different. And again, if that's not clear enough, please retype your questions on here. Next question is there any place that has all the copays and options laid out next to each other, other across different providers? And I provided this answer here. We do have our benefit digital guides online, and you could find your specific one through our main website landing page, which is our very own sfhss.org/OE 2026. And one of those pages will have the summary of benefits on there. Okay. Question here for Blue Shield. I tried using Blue Shield Trio or Access Plus a couple of years ago, and when I initially looked, I thought I could keep my same providers, but it turns out I could not. I kept being assigned to a different health group, not in my area. How can I double check this if I switch out of PPO? And Adam responded with Blue Shield to check to see if your providers are contracted with Blue Shield and what medical group they're in with Blue Shield. You can either look them up yourself by going through their website, which is www.blueshieldca.com/network HMO. And for Access Plus, that's www.blueshieldca.com/Trio SFHSS. Again, that's for Trio. And for Trio, you can also call their 1-800 number, which is 1-800-357-1901. And you can speak to a Blue Shield concierge representative who can assist you as well. All right, let's see what else is here. Our fertility services covered under all medical plans. And for Kaiser, Paulo had responded, you can view our fertility care coverage on the evidence of coverage document posted on our SFHSS website. And the website, if you click on here on your Q&A box, you should be able to, it will lead you to that specific page. But in a nutshell, what Paulo was stating, starting in 2026, fertility services like IVF will be covered at a copay. And Paulo, I don't know if you want to add on to that, or that's pretty much self-explanatory.
Yeah, no, it's pretty much self-explanatory. It can get pretty complex. That's why I don't want to get into the
Yeah.
weeds. And I posted the evidence of coverage, but if there's any follow-up questions, we're happy to try to answer.
Yeah,
There's
great. Yeah.
also another website that I put on there, kpivf.com, that people can explore different treatment options as well.
Thank you, Paulo. And again, to our members, if you are still unclear with your questions, please retype it on here. And I'm trying to get through this as much as I could. Next question, which of these health providers have affiliation to other providers internationally? And Adam from Blue Shield, I responded, the Blue Shield PPO plan offers coverage worldwide via our Blue Card Global Care Program. And I don't know if any of our other vendors would like to chime in regarding this question. Okay, hearing none. Oh,
I'll say for HealthNet, we don't.
Hmm?
Yeah, we don't have that. So just want to clarify.
Got it. Thank you, Fred.
For Kaiser, you are covered for urgent and emergency care like anywhere in the world. So that is.
Did everyone hear that? Elizabeth, could you repeat that one more time? You're a little bit muffled there for a second. Or
I think that was Jessica from Kaiser.
Oh, Jessica, sorry.
Yeah,
Jessica.
no worries. I think what she said was that with Kaiser, you have coverage for emergencies and urgent care anywhere in the world. Although we don't have any, specific affiliations with providers internationally, you do have that travel away from home coverage.
All right, thank you, Paulo. Another question here, where are the costs for the new life insurance policy? This is answered by Olga, our very own. The cost of the life policies is available by going through Workterra, through my apps portal at our own website, which is www.sfgov.org/sfc/employee-gateway. And next question, how much copayment for seeing a doctor with the Blue Shield, the HMO, Canopy, and Kaiser are there acupuncture and mental health access plus plan in Blue Shield? Not sure if I'm understanding this question, but I think how I'm understanding this is our member is asking how much is the copayment if you see a acupuncturist or mental health services. And I guess we can start with Blue Shield first. Adam, if you could chime in on that.
Yeah, absolutely. For acupuncture and chiropractic benefits, you have $15 per visit for an office visit, and then if there are any chiropractic appliances that you need to have, those are it's $50 for all charges above $50.
Thank you, Adam. Anyone from Kaiser would like to chime in?
Sure. So for Kaiser, you are covered for chiropractic and acupuncture benefits, and for a calendar year, you have total 30 visits per calendar year, and each visit copayment is $15. And you get the services through American Specialty. And I will post the American Specialty and KP provider search link through the chat.
Great, thanks so much. Does the city still offer long-term care insurance? Yeah, you can reach out to Workterra for any consultations, which is, the link is provided here. It's Workterra, BOE.com. Again, that's WORKTERRA, V as in Victor, BOE.com /. Once you click on that link, it should send you to a site where you can make your appointment through there. And Olga had also mentioned SFHSS does not offer long-term care insurance. The policy with an accelerated death benefit for long-term care is through Chubb Lifetime Benefit Term Insurance with accelerated death benefit for long-term care. And to sign up for Chubb, you will need to visit the Workterra site through the My Apps portal. And that link is sfgov.org/SFC/employee-gateway. I don't know if Olga, you want to add more, but I think that's self-explanatory.
Nothing
And
additional to add. Thanks.
okay, thank you. Just making sure. And you know, at this time, we have 5 minutes left, so just giving everyone a heads up. If you have any questions, please type it in, and let me answer or read some of these questions that I've missed. What's the Blue Cross concierge phone number? This one's pretty easy, 1-800-357-1901. Next question is re-enrollment in 2026 required in order to enroll 2025 FSA funds over? Yes, if you wish to enroll in FSA for 2026, you are required to re-enroll. This applies to both healthcare FSA and dependent care FSA.
And Jay, I
And
think
if
there's a follow-up. Sorry, I was going to
Yeah,
answer
go ahead,
the
go ahead.
follow-up. That's okay. Yes, so if you are looking to only do the rollover, there is a maximum of $610 that you can roll over for the healthcare FSA into plan year 2026. If you are looking for an answer for the dependent care FSA, it's a use it or lose it account. So make sure that whatever expenses that you have for the dependent care FSA, you utilize all the funds in this plan year. That's for dependent care FSA. For healthcare FSA, up to $610 can be rolled over, and I believe the minimum rollover is $10.
Great, thank you for that, Olga. Uh, last question here is, does Access Plus HMO also provide urgent care emergency service coverage worldwide as well? And the member is saying that they've heard that Kaiser Permanente does. Ed, I don't know if you want to take that first.
Yeah, if you're looking to live internationally, then you would want to be in the PPO plan. But if you are on the Access Plus or Trio plans and you're just traveling out of the country, you do have access to urgent and emergent benefits. Just make sure if you do access services out of the country that when you leave, you have them give you an itemized bill in English so that when you get back to your home, you can file what we call a foreign claim, and there's no delay in you getting your payment because the claim would then be processed less your benefits. But if the bill is not itemized and it's not in English, we're going to send it back to you and ask that you have this done, and the hospital or wherever you were will most likely charge you for it.
Great, thank you, Adam. And are any of our representatives from Kaiser can just clarify if that is true with Kaiser as well?
For Kaiser, the active and retiree employee, you will also cover for travel for urgent and emergency care. So is it asking for international residents? I'm sorry, the questions.
Yeah, they didn't really specify where the residency is, but yeah, it's asking if they do provide urgent care or emergency service coverage worldwide as well.
Yes.
Yeah.
That's correct.
Yeah, Jay, this is HealthNet. I mean, all the
sorry.
vendors are aligned that way, I think, covering emergency care worldwide. And so we're aligned with Blue Shield, what Adam mentioned about everything, the foreign claim form, making sure that all the proper receipts and paperwork is translated. Otherwise, we can't process it.
Yeah, that's a great point. Thanks so much, Fred. And at this point, just respecting everyone's time, this concludes our webinar. Thank you for joining us today and asking those great questions. Thank you to all our vendors for providing the answers. We hope you found this webinar informative and that you'll join us for another webinar during the open enrollment. Thank you, and remember to submit your changes before October 24th at 5 p.m. And have a wonderful rest of your day. Thank you, everyone.
Bye, everyone.